Oh, sure. There are a lot of vaccines that adults need to get and need to keep up on. The first one is actually a pneumonia vaccine, and this is something that actually keeps people from getting what's called pneumococcal pneumonia, which used to kill lots and lots of people in America. And this is a vaccine that you should get probably in your 60s. It really depends on your individual situation. Depending on whether you have something like diabetes or lung disease, you may want to get it a little earlier. But you should talk to your doctor about a pneumonia vaccine if you haven't gotten one. A second vaccine that you should get is something called RSV vaccine, a respiratory syncytial virus. And RSV is a virus that affects very old people and very young people. And so if you're over 65, and I'm over 65, it's very important that you get this vaccine to keep you from getting sick, because while anybody can get it, it makes those two categories very, very ill. And sometimes people end up in the hospital with pneumonia. A third vaccine is the pertussis vaccine. It's typically in what's called DPT, diphtheria, pertussis, and tetanus. But this vaccine tends to wane over time. And so, again, as people get older, if they had the DPT when they were kids, or maybe young men got it when they were in the military, by the time you're in your 60s or 70s, that vaccine doesn't work anymore. And we're actually seeing a large number of increasing cases of pertussis. And pertussis typically gives what's called whooping cough. And whooping cough is where people get fever and they get a cough and then they get that whoop. That's why it's called whooping cough, because when they take a deep breath in, it makes that sound. And so it's very important to get that vaccine. And then, of course, all the vaccines you get yearly. People don't like to do it, but it's important to get a flu shot every year. It's important to get a COVID shot every year. And people are saying, why do I need to get a COVID shot? I got one last year. Because COVID's still around. It's still making people sick. People are still ending up in the hospital. And some people are still dying from it. Not nearly as many people as during the height of the pandemic, but it's still here. And if you're in a risk group, you do need to be cautious about it.